So seriously, how many of you feel like this year has been an episode of Stranger Things? Myself included. So we're going to talk about COVID-19 for a little while. COVID-19 originated in Wuhan, China at the end of last year. It's SARS-CoV-2, which is severe acute respiratory syndrome coronavirus 2, a new respiratory virus in humans. It is a large envelope single-stranded RNA virus. The pathophysiology of COVID-19 is thought that the virus binds to epithelial cells in the nasal cavity, starts replicating, migrates down the respiratory tract along conducting airways, and triggers an immune response. COVID-19 can be diagnosed either through a nasal or oral swab, and there is a rapid COVID test that can give results in minutes to hours, and there also is a longer COVID test. It's a PCR test, which is more sensitive, and that usually takes 3 to 4 days to get results. It's primarily transmitted from person to person through respiratory droplets, so coughing, sneezing, talking, and spitting are all ways that COVID can be transmitted, which is how we've come to have this love-hate relationship with face masks that have been the epitome of this year, it seems like. Many patients with COVID-19 present with cough, shortness of breath, headache, fatigue, nausea, vomiting, diarrhea, and a loss of taste and smell. In mild cases, patients usually recover in 1 to 2 weeks. However, in more severe cases, it usually takes 6 weeks or more for patients to recover, and unfortunately, many patients have died from COVID-19. The incubation period is 14 days with a median time of 4 to 5 days from exposure to symptom onset. Recovery looks different for everyone. We still don't know all the long-term effects from COVID-19. However, it's been reported that many patients who have contracted the virus have clotting cascade issues later on. Treatment is usually just supportive and management of symptoms. However, the FDA has recently approved the emergency authorization of remdesivir, which is an antiviral, and many hospitals are also using plasmapheresis or plasma exchange to treat patients with COVID-19. COVID-19 has totally changed the way we do healthcare and has just changed the world. As a bedside ICU nurse, I never expected that I would have to wear a mask at all times to work, but also never expected that I would see a shortage of personal protective equipment and would have to be reusing an N95 mask. However, I think the most devastating effect or thing that I've seen due to this virus is seeing loved ones die at the bedside alone. It's heartbreaking. As a future nurse educator, I think this is going to totally change the curriculum. We will have to incorporate COVID-19 into every course, including pathophysiology, teach students how to properly don and doff PPE when caring for these patients, and it's just totally changed life as we know it. COVID-19 is devastating. So, thank you for watching this week's episode of Stranger Things.